I'm Pat McMahon. Let me introduce you to a couple of my guests who have a marvelous responsibility and job. They make kids healthier and happier at Phoenix Children's Hospital. Doctors and nurses? Nope. It's Camus and Yankee, and it's good to see you. Absolutely. Time for my close-up, Mr. DeMille. And Mary Lou Jennings. Mary Lou Jennings, the coordinator of the program at Phoenix Children's Hospital called what?
Animal-assisted therapy. Phoenix Children's Animal-assisted therapy. We also call it Paws Can Heal.
And it is really therapeutic for those kids, isn't it?
It is. We truly have a therapeutic program. Let me introduce you to Cheryl, who has Yankee, and Michelle, who has Camus. And they really come in and do some therapeutic work every day.
Okay, now the training itself consists of what?
All of our dogs are registered therapy animals, so they have to go through basic dog obedience skills, so that could take a year or two, and then they have to go through additional training to be sure that they're going to behave appropriately in a closed setting like a hospital. Where
Now,
they're...
as you know, Mary Lou, I have a golden doodle, that's their breed, and it's also a therapy dog. How long is the additional training at PCH before Bijou, my dog, can go around and visit with the kids?
We have a requirement that they do a little bit of therapeutic volunteer work outside of Phoenix Children's before they even come in, so maybe 3 to 6 months somewhere where they learn the basic skills, and then they come to me and we do, 3 to 6 months of some additional training where I'm with them often and they're shadowing other teams and learning the ropes there.
You probably don't even have to worry about the training of the dogs. It's the training of the Cheryls and the Michelles that you have to be concerned about. And there's a whole bunch of folks out there right now saying, how do I get to be one of them?
Exactly, and you're right. It is the people that we train. The dogs just want to do what we want them to do, right? They want to make us happy, and they want to. But these dogs want to be with kids, so that's something that they always have to look for. If your dog really enjoys children, then this may be a job for them. So you do your dog obedience, and then you start working towards getting registered as a therapy animal. And there's 3 or 4 national organizations that do that. That you can go through their evaluation process and their training process.
And talk to us about what the dogs do for the kids.
So like Yankee goes in very early on Monday mornings when kids are getting ready for surgery and spends some time with the kids and their families who are very nervous about surgery, and helps to calm those nerves and get them ready to see their doctors and anesthesiologists. And then Michelle will go in with Camus on the weekends, and we have kids who are here for a long time that might be having a hard time coping with the idea of being in a hospital for a long time, or they're working really hard at their physical therapy and occupational therapy, and they don't really like it, especially on the weekends. So our dogs can go in with those kids, help them do the exercises they need to do, keep busy.
And folks, let me tell you, I've been fortunate enough to be at Phoenix Children's Hospital while some of the dogs have been visiting those rooms. And I want to tell you, a child in a hospital bed, no matter how splendid the staff is, they hear somebody at the door and they don't know whether it's somebody with a needle, somebody with some medicine that doesn't taste that good, there's somebody that has to do something physical to them that maybe is going to hurt. And there's some concern every time somebody's at the door. And then the door opens and Yankee comes in, or Camus, or any of the other wonderful dogs that are in this program, and the kids light up like it's Christmas time. And it makes a difference in the therapy, doesn't it?
It makes a huge difference. So we completed a research study not that many years ago, and we were just published, as a matter of fact, and we were able to show that patients' cortisol levels went down and their activity levels went up after they've seen a therapy dog. So we actually measured, we took their saliva and we measured their cortisol 5 minutes after a visit, 20 minutes after a visit, 60 minutes after a visit, and 3 hours after a visit. And we found significant results. So anxiety goes down. When your anxiety goes down, you're able to do a lot of things. Your body will start to work better. Even your digestive and your respiratory tract will work better.
Now, these are golden doodles. What about selecting a breed? Are there some breeds that work with the kids better than others?
There are breeds that are just born for therapy dog work. So golden retrievers, Labrador retrievers are very interested in pleasing, but also the smart dogs, you know, the poodles and the cattle dogs and the border collies. Those are all great, and a lot of those mixes. So these guys are mixes. They're doodles. So they've got the golden retriever, which is lovely and charming and wanting to visit and interact. And then they have the poodle that's very smart and a little hypoallergenic. So you mix those two together.
There's nobody that ever says to the dog, once the dog comes into the room, none of the dogs are restricted from getting on the furniture.
Oh no, and that's what you're seeing these guys do at laying on the floor is what they do best. They love getting up on the beds or up on the couch or on the chair with the kid and just relaxing. So that has a lot to do with what's causing that de-anxiety, you know, reducing their anxiety. If you can get a dog on the bed and relaxing with you, you will hear both parents and children give you that great big sigh.
There's a family right now watching whose child is going to be going to Phoenix Children's Hospital pretty soon. And they want to know how to get in touch with you about making arrangements for one of the dogs to come in.
So we have a really unique system in that the doctors and the physical therapists, child life specialists, they put in orders for animal-assisted therapy. So pet therapy comes to their door based on an order, just like an x-ray or a respiratory therapy treatment.
It's all very well organized at Phoenix Children's Hospital. And here, this segment is organized because we had Mary Lou Jennings and Cheryl and Michelle, but far more importantly, we had Yankee and Camus.